CMV or cytomegalo virus is a common virus that infects people of all ages. People who have healthy immune systems are usually asymptomatic and don't require medical treatment. However, those with weakened immune systems, such as unborn babies, can have severe symptoms when infected. Cytomegalovirus is known as congenital CMV when unborn babies are infected and usually results in severe disease. CMV is part of the herpes viridae family, which has a double-stranded DNA in a lipid envelope. CMV is known for its owl-eye inclusion bodies. The mode of transmission for CMV can come from direct contact with saliva or urine from babies or infants, direct contact with bodily fluids during sexual contact, direct contact from organ transplants from CMV seropositive donors. These patients are also more susceptible to CMV infection due to a weakened immune system, or indirect contact with fomites, which are inanimate objects infected with the virus. The signs and symptoms for CMV are that some adults may experience lethargy, high temperature, a drop in white blood cells, mild or flu-like symptoms. Some adults may be asymptomatic. Unborn babies may experience deafness, poor eyesight, intellectual disability, an enlarged liver or spleen, or a small head. Organ transplant patients may experience serious organ infections. Other than antiviral treatment for immunocompromised patients with life-threatening illnesses or eye infections from CMV, there is no specific treatment for CMV. Preventive measures against CMV include hand washing. Disposable gloves should be worn during exposure to soil lining with feces or urine, and exposure to bodily fluids from those infected with CMV should be avoided. The diagnosis for CMV is that for older people than 42 months of age, a serology test such as an enzyme-linked immunosorbent assay known as the ELISA detects CMV antibodies, IgM, and IgG. For newborns, a polymerase chain reaction test on urine and saliva is collected to determine congenital CMV. CMV can enter through the upper GI tract, genitourinary tract, and the respiratory tract, which then infects lymphocytes and spreads to multiple tissues. During latency, monocytes are infected and carries the virus and reactivates, which can cause symptoms for some.